this hot topic event is about digital medicine, and we've called it Refilling the Innovator's Prescription. We wrote a report here at Nesta by the same title very recently, and we're really interested in the idea of bringing together trends in big data and big data analysis with trends in healthcare, particularly new types of medical technology and medical devices. We've asked Sherry Coutu and Haywood to come here and tell us a little bit about this from the investor's perspective and also the government's perspective. Only last year we released a research report called Dr. No, the Health Knowledge Commons, which looked at a real switch in the healthcare system, one that is much more people or patient-centric, one that takes on some of the lessons of user-led innovation and thinks of that at a sectoral level. So this is not something we don't know about, and I think it's quite exciting to have a topic on something that in the next year or so we're actually hoping to start to fund more of this, thinking more about the way that we use data in healthcare to facilitate innovation.
We absolutely have the intention of embarking on activities that will help bring together groups of people and groups of people that haven't perhaps traditionally worked with the NHS and with the higher education institutes that we have in London. So digital health is a perfect example of that. It's a new and emerging sector of the traditional medtech sector, and it's something that we want to embrace, particularly because we have real strengths in tech within London and we have the strengths in life sciences, and it's absolutely natural that we should try and bring them together.
I think that the MedCity initiative that was announced by Boris Johnson a couple of weeks ago is really helpful for the UK. There are 3 or 4 sectors where the UK should absolutely have the ability on a global basis to produce amazing companies that are globally dominant and whose products can't be produced anywhere else. And I think MedCity has the capacity to make more of those faster than otherwise would have happened. It was a $1 trillion valuation company, not revenue, and we usually talk about when we set it, we felt that we could easily get to a billion in revenues for a medtech company. We have the NHS. It is such a concentrated system, and we have ginormous data sets. Those data sets do not exist in the US because they're county by county or they're state by state. You've got people who have come from other industries, maybe they're financial services, maybe they're advertising, and they know how to do things with data. We pull people in from Amazon who've been working on getting conversion rates from one tiny percentage to another by creating their algorithms, and we ask them the question, well, if you can do this just to increase revenue or increase conversion rate on how many people click on how many books, can't you do that in oncology? And if you had a data set that you could do this to, couldn't you do the same thing? And the answer is yes. There's lots of lessons from other industries that are directly applicable to healthcare.
So MedCity is, as it was announced, something that's got funding for a couple of years, but its vision is ambitious. Its vision is about 20 years, about building London and the Greater South East into an undisputed leader of connected life sciences capability that can compete with the rest of the world. And from my perspective, it's extremely exciting to be in there right at the beginning. And it's really exciting to be talking about digital health today, which is absolutely about the merging together of what have been 2 different worlds, but in colliding will create huge opportunities and huge changes in the way in which the health system operates. And one thing I absolutely want to get across to you is that MedCity wants to be part of that process and to help.